I'm originally from England. I came to this country 40 years ago. One of the reasons I left England was I found that there was less and less opportunity over there. At that point in time, the government was beginning to going through the process of creating a lot of social programs, including healthcare, which really took care of the citizen from cradle to the coffin. And I found that an awful lot of people thought, well, this is a great idea, and they sort of accepted that, and they began to lose their enthusiasm to work hard and to improve their lives, and rely more and more on the government to take care of them. I was in a different school. I had served my country for 7 years, and my Queen for 7 years, and at that point in time I decided that I wanted to better my life. And I found that it was very, very difficult to do that in England because there seemed to be very little opportunity there. And those that really wanted to improve their lives and went to work found that the tax system became a greater and greater burden because of all the social programs that went on. So I left England and I came to the United States as a legal immigrant, and later on I became an American citizen. And I'm very much involved in what's going on in this country, to this day. A point that I'd like to make, I call my friends and my family just about every week, and I called a very dear friend last week who has part of her nose removed from cancer. She has cancer outbreaks on the rest of her face right now. She's in her late 70s, early 80s, and she has waited for 6 weeks to schedule an appointment to see her physician. At this point in time, she does not have that appointment. And it seems to me that the health system in the UK is completely overwhelmed. There is a shortage of doctors, and that people who are on the healthcare system are rationed. And if you happen to be in your late 80s, you're somewhat expendable. That is what is happening over there. And I'm very, very concerned that that may happen here going forward. So that's my first question.
Good, sir. Could I ask you just to hold and let's get an answer?
Let me just wrap it up. The bill promises quality health care going forward. And my question to you is, how can you guarantee and assure us that we will continue to get quality health care in the future? Thank you.
That you can bring more people into what's going to be an obviously growing need. Because of the improvements and certainly in the pharmaceuticals and healthcare. As we grow older, I find I have more collection of spare parts, right? Because they can extend the life expectancy in families. And so as that occurs, the demand is going to grow. And having the constituency and having the people who can serve it is going to be absolutely essential. So again, it's a great question. The purpose of this gathering is to talk specifically about quality and how we can maintain it. And obviously, again, having choices. And I think one of the rubs has been on other programs around the world has been that there weren't choices. People had one choice, and that was all there was. And so you end up trying to funnel an awful lot of people into one system. I don't think that should happen here. Again, I think we need a uniquely American program here that serves our interests, our diversity, and our needs, not to try and graft somebody else's program on our nation. And so if you have that kind of diversity in it, I think you have a greater opportunity with that competition and choice. That people then, through that process, begin to shop and do what we do. When you shop, you'll find that people want to compete, and they'll do better. If you don't have to compete, then the quality will drop. So choices, I'm going to call it choices, competition, that, in my experience, has been one of the best guarantors of quality.